Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell International. Today we're talking about a groundbreaking new program that we've put together. It's taken us a long time to come up with it, to make it a reality. It's the Billion Stem Cell Program. This program is the first of its kind anywhere. I can assure you that it's never been done before. And what we found over the years of offering procedures is that stem cell counts matter. Over the past decade, it's become very clear that the amount of stem cells provided often has a direct correlation with a patient's outcome. The goal then is for us to offer the 1 billion stem cell program for patients with serious conditions who want the best outcome with the newest technology available. So there are 4 overriding principles that we've had since day one, 9 years ago, that we've never wavered from and won't. Patient safety is paramount. There's no use in coming up with a billion stem cell program if it's going to compromise any safety that we have put assurances in place. Our stem cell biologic quality is uncompromising. Patient outcomes continue to guide our best practice treatment protocols. This is not just outcomes at our centers, but outcomes that are seen in the peer-reviewed literature. We want to make sure that what we're offering to patients is the best option available, not just the cheapest, not just more cells because we can. We want to make sure that it's what patients need and are going to benefit from. Now, treatments need to be cost-effective by using our volume to leverage savings for patients. Now, where are we today? Well, after 9 years, our 3 centers of excellence have performed over 16,000 procedures around the world. We have 45 centers. We have an 85% overall customer satisfaction. Now, that includes everything. Knee arthritis, hip, shoulder arthritis, where it's going to be over 90-some%, as well as patients who have diabetes, COPD, spinal cord injury. So you put all that together, 85%. What that means is a year out, 85 out of 100 patients say they would have the procedure again, or they would recommend it to friends and family. We've never had a significant adverse event, and we are the most cost-effective, clinically effective, and safest stem cell therapies in the world. How do we achieve that goal? Well, we figured out how to leverage our volume into a cost-effective stem cell expansion program. Expansion means culturing. You need to do that to get to the billion stem cell count. And when we did this with our medical team, we were able to achieve the billion stem cell counts that are just as safe and high quality as ever, for great outcomes at a price point that is unmatched anywhere. All right, so let's go through a few questions. Are a billion stem cells safe for patients? And the answer is yes, they are. We don't use embryonic stem cells. We don't use induced pluripotent stem cells. Neither of those are ready for prime time. And the embryonic ones typically come from aborted fetuses. But even if you get past that ethical issue, there's problems with tumor formation, rejection. So we use donated umbilical cords. Normally, the umbilical cord is considered medical waste. So it has millions and millions of mesenchymal stem cells and hematopoietic stem cells. And these are donated after a scheduled C-section. There's no harm to baby or mother. And these treatments are administered over several treatment sessions. We don't give the whole billion stem cells at once. You could. I'll show you a paper on the next slide that did that. And we also include exosomes for maximal effect, at least 100 billion. I've talked on presentations about exosomes. They are stem cell byproducts that are very active in cell-to-cell communication. So this was a paper looking at patients who had ischemic stroke, and they wanted to look at the safety and effectiveness. So they randomized these patients into receiving either 600 million stem cells in one setting or 1.2 billion. They didn't have any toxicity events. They didn't have any allergic reactions, no differences in adverse events between the groups, so very safe. Now, are a billion stem cells effective clinically? The answer is yes, but it's not always necessary. For instance, you may do just as well with 50 million stem cells as a billion. So it could be too much, for a lot of patients. Most conditions do well with 50 to 200 million stem cells. The paper below actually looked at that over a 15-year period. They looked at every stem cell clinical trial they could find. They wanted to find out if there was an optimal dose range for various conditions. So for quite a few conditions, you don't need a billion stem cells. Now, how do the stem cells work? Well, a lot of patients think that when they get a stem cell therapy, those are the stem cells that are going to turn into their cartilage or their lung tissue or whatnot. That's predominantly not how it works. Paracrine interactions are predominant, and that's a fancy word for cell-to-cell communication. Stem cells love to communicate, and they do it in such a way that they wake up a lot of quiet processes in the body to help participate in repair, regeneration. There's also a lot of immune modulation. What that means is amping up protective cytokines and growth factors in the immune system and tamping down those that are harmful. So, for instance, in COVID patients, when they have a cytokine storm that can lead to lung failure, this can help stop that in its tracks and help patients. Multiple studies are showing that. So, reducing inflammation. Chronic disease has inflammation that comes along with it. It's just a fact of life. And that inflammation is not helpful. So the stem cell therapy can help reduce that inflammation nicely. There are some direct mechanisms of stem cell therapy. We don't exactly understand that really well. There's also a teamwork approach. The way that I describe it is when you get these biologics, yeah, you're getting a billion stem cells, but you're also getting a whole team, a virtual orchestra of different proteins and growth factors and cell types that come along and help participate. And when you look at an orchestra, the sum is greater than the parts, right? That's the same type of thing with the billion stem cell program. Now, let's look at something very important. Is it a cost-effective program? Well, we wouldn't have put it forward if it wasn't cost-effective, but let's just look at a little math. So currently, we offer 50 million stem cells for only $3,950. But if you multiply that by 20 to reach a billion, that would add up to close to $80,000 US dollars. And that is not cost-effective, in any of our minds. So we worked with the lab and our treatment team, and we ended up coming up to a billion stem cells along with 100, 200 billion exosomes for only $29,975. You are not going to be able to find a program with the components that we put together for the billion stem cell program anywhere in the world. So who is a candidate for a billion stem cells? Well, not every patient. In fact, more like 9 out of 10 are not going to be candidates for the program. But here are some conditions that do often fit. Spinal cord injury can benefit tremendously from higher stem cell counts. Some spinal cord injury patients are not going to be a candidate at all. Our medical directors will look at your case and talk to you and your family. Post-stroke may be a candidate. COVID or post-COVID, 30% of post-COVID patients end up with serious problems, mostly in the lung, and we can help with that. Cerebral palsy in kids, I'll show you in a moment a study. ALS or MS, certain severity of liver failure and kidney failure. Alzheimer's, Parkinson's, pulmonary fibrosis, some genetic conditions. I put asterisks there because stem cell therapy is not a cure for a genetic condition, but it can help tremendously for people who have genetic issues. And then also if someone has a combination of conditions or maybe a really less common condition that can benefit as well. How are the treatments performed? Well, at R3, it's not one hammer or one nail. How it gets performed is going to vary based on each patient's needs. It could be an IV, which is very safe. Injection, maybe into a joint or soft tissue. Intranasal, intrathecal is very helpful for neurologic conditions when we want to get a large amount of stem cells into the central nervous system. It's been a very safe procedure. Our anesthesiologists perform it. It's basically a lumbar puncture, and then nebulizer, intramuscular, and possibly intralymphatic. Do the numbers of stem cells matter for treatment? Well, it's kind of a rhetorical question. We wouldn't have introduced this program if we didn't feel really, really strongly that it does. But they absolutely matter. The latest data on conditions shows that to a point, higher numbers are better. You may not need a billion, but I'll show you in a moment some studies to back this up. 10 to 50 million cells per kilogram is a lot of what you'll see. We do also include exosomes at no additional charge, as I mentioned earlier, at least 100 billion. So let's go through a few studies. Here's a study out of Duke University looking at 63 children with cerebral palsy. Now, they observed that children who received higher stem cell doses, over 20 million cells per kilogram, demonstrated superior gains in both whole brain connectivity and motor function. And I don't expect anybody to understand what these charts show. I just pulled it from the paper. But for example, on this bottom right one, the green are the patients who had the higher stem cell dose, and they just did better in this outcome instrument. They did better here. They did better here. So now think about it. If a child weighs, let's say 20 kilograms, and they got over 20 million cells per kilogram, let's say they got 40 million, because that was the minimum, was 20. That's 800 million stem cells. So it's a lot that these kids can not only tolerate, but do well with. Here's a study on idiopathic pulmonary fibrosis. 20 patients in Russia. They received 2 IV doses every 3 months. And the total that for each patient was 1.6 billion. They had some mild adverse events. We do see these too: transient chills, fever, nausea, usually resolves within 24 hours. Patients in the main group had their lung function increased as compared to the placebo group, which continued to decline. Here's a study looking at placenta-derived stem cells for multiple sclerosis. This was about 20 patients. They randomized and double-blinded it. More of a pilot study, but the low-dose patients got 150 million. The high dose got 600 million. And they did MRIs every month. They looked at progression or lack of progression. And what they found is in each patient with the high dose group, which is on the right, you can see that predominantly at 1 year they had not progressed with their MS. A little bit of progression here. Here you ended up about the same at baseline, so on and so forth. Whereas on the left with the low dose, quite a few declined. But this was not enough to be, quote, statistically significant. So higher doses appear to work better. So what kind of outcome can I expect? For how long? It's a really loaded question. Overall, patient satisfaction, as I've mentioned, is 85%. The average effective length is 3.5 years. So this is not a 2-week, improvement phenomenon. It's usually longish term, but every patient's not going to be the same, right? You're going to have those who are low responders. It doesn't matter how many stem cells you give. They're just not going to do well with that. Most of the time what we see is medium responders who are very happy with their outcome. They've got some functional improvements. Their pain has been relieved. They can breathe better, walk farther, all those types of things. And then you're going to have, super responders who do amazingly well with the treatment. And those are very, very exciting. But we have to make sure the expectations are not too out of hand. So what are the risks? Well, overall, these have been very safe procedures. We've never seen a reaction. We have not seen a disease transmission, although theoretically it could be possible because the tissue is from a donor, right? Very low risk of infection. We've never seen a deep infection. We have seen some superficial cellulitis, which antibiotics just knocked out. Usually it's things like low-grade fever, dizziness, lightheadedness, chills, nausea that resolves within about 24 hours. So how do we come up with our pricing? And are there any extra fees? The goal for us since day one was to put together the Mercedes of stem cell treatment for the pricing of Afford. And that's been our mantra. And we have been able to do that, and we continue to do that with the Billion Stem Cell Program as the most cost-effective stem cell program in the world. Our mission is to make effective stem cell therapy available to virtually everyone in need. For instance, if you just are going to do well with 30 million stem cells, we offer that for $2,950, okay? There are no extra fees with this Billion Stem Cell Program. There's no extra fees for intrathecal. There's no extra fees for sedation. Whatever you need to go along with this, if you're going to have the program in the 10 to 14 days, that's fine. If we deem, our medical director deems it better that you'll do better over multiple treatments for the year, the pricing doesn't change. All right, so where do we perform these treatments? Well, multiple locations in Mexico, Tijuana, Cancun, and Islamabad, Pakistan. Those locations offer the umbilical cord stem cells and exosomes, adding up to 1 billion stem cells and 100 or 200 billion exosomes. In Honduras, in Roatan, Honduras, it's a fantastic program where you do get 1 billion stem cells, but about half are umbilical cord stem cells and the rest are autologous adipose. So partially they're from you and the other part from umbilical cord. So the process starts with a phone consultation with one of our experienced stem cell doctors. You will be assigned a dedicated patient concierge rep to assist with all your travel logistics. Any questions you have along the way, we'll get you an answer ASAP. And we do include ground transportation from the airport to the clinic, hotel, and back. We just don't include the airfare and the hotel itself. That's patient responsibility. There is financing available for patients from the U.S. or Canada. The total cost, as mentioned, is $29,975. You can either have the treatment over a 2-week period or several visits over a year. The pricing is the same. You can pay in increments with R3. You can use financing. If you pay it all at once, we'll give you a 5% discount. Now, if you're a U.S. resident or a Canadian resident, there are options we'll help you with that. You don't have to have the treatments in those countries. You can go wherever you want. We do have a pristine safety record. The labs we have meet or exceed FDA quality assurance standards. They're very stringent standards. We do test very, very high level for all kinds of communicable diseases, bacteria, viruses. These labs are ISO 7, CGMP compliant. We do achieve over 95% viability with our stem cells. And these are very pure, potent cells that are below the 5th generation of culturing, meaning they're very pure, potent, and active. R3 has been recognized a lot lately for awards. USA's leading regenerative therapy services provider. We've been featured on every major media outlet. Also received 10 Best Companies of the Year, 10 Most Innovative Companies of the Year, 50 Smartest. To start the process, you can visit us online at r3stem.com or give us a call on the USA prefix of +1 888 988 0515. You can also email us at info@r3stemcell.com. Thank you so much for watching, and we look forward to working with you.